Hey everyone, this is Dr. Brian Kaproff. I am really excited to start talking to you about our new XDoc or documentation system that we're releasing. It's been years in the making. So today what we're going to cover is how the new XDocs platform is going to save you tremendous amounts of time, money, and also give you an unprecedented amount of peace of mind when it comes to documentation, coding, billing, and the whole nine. So let's get into how the XDoc platform is going to save you a lot of time. So right off the bat, you're going to see that it's really going to be very easy for your staff to send a patient their intake forms through a HIPAA compliant portal. A lot of systems have their links for intake forms on their websites and things like that. It's really not compliant. So what we're going to have now is that it's really easy for your staff to just send the patient the intake form. Once the patient logs into their HIPAA compliant portal, you'll see it's going to be a step-by-step wizard for them to enter all of their information, including obviously their complaints, their activities of daily living, their family history, their social history. What's even better about the intake form for the patient is if they select neck pain, for example, it's going to give them the outcome assessment tools for neck pain. If they select that this problem started as a result of an auto accident or an injury at work, it's going to automatically give them the intake forms for auto accidents or workers' comp intake forms. So it's step by step for the patient. It's easy for them to follow. All that information is going to be easy for them. Once they save this, or once they finish and actually sign this, which they can sign with their finger on their touch screen. Once they sign this, it's saved, and it's saved inside the patient's file. All right, now we can see this exam. Once you open that up for that patient, first time they're in your office, you can see that the information that was entered by the patient in the intake form is actually already populated your exam. And this can be across any specialty. So if you have a physical therapist or medical doctor, they can all create a new exam and the pertinent information will carry forward, including things like their intake summary, where you can see their neck pain disability index, their goals of care, their family history, their social history. Everything is already populated. And you can also see that your input section on the left is mirrored on the right by your actual real-time narrative generator. On subsequent visits, you'll be able to see, just by clicking on a different type of document or different view, you can see that the narrative automatically updates to that type of note. So in this case, a daily note. Subjective complaints, patients can enter their subjective complaints and pay rating scales at the intake kiosk, and that will automatically populate your note for you so you don't have to double check. You'll notice that there's the ability to create and manage your macros. Any type of thing that you do on a regular basis for your exams or your daily notes where you just want to populate or click a whole bunch of buttons, you can save as a macro and that will automatically populate. Field level macros allow you to save multiple customized sentences and phrases at the field level, giving you total control and customization. One of the most important and biggest time savers you will see is the ability to create a claim in real time based on your documentation. By clicking just one button, you will see the diagnosis codes and procedure codes that have been selected or created from your note. And with one click of a button, you can complete the note, sign the note, and send off the claim in real time. With the new patient tile navigation, you can see how easy it is to click between patients for different types of visits. New patients, adjustments, and so on. And how just by clicking on the patient, you can see the appropriate document comes up on the left-hand side. This is for patients that are in the office still that have not been charged or documented. This is especially useful for offices that have rehab areas that need to switch between patients quickly, or busy chiropractic offices where you need to keep track of patients that are checked into your office. This navigation bar can be quickly hidden. You'll also see that on the right hand side you can get to all of the information that you need with one touch of the touch screen. Patient information, including all their account transactions information, patient files, which would include x-rays, PHI information, documents, so a full history of all their documents where you can print, fax, all their documents from that tab, any tasks that are outstanding or related to this patient, any notes that you might keep on this patient that are outside of your documentation, your care plan information, any prescriptions, and referral information. Now let's talk about how the XDoc platform is going to maximize your collections. Number one is the documentation process for Medicare, Major Med, cash, workers' comp, and personal injury is now all the same. So you do not need to change your documentation process based on the type of payer that the patient has at the moment. Since the documentation platform is extremely intelligent and improving all the time, the code that you can submit based on the documentation you have will be optimized, including the number of units, modifiers, diagnosis code linking, etc. With real-time claim submission and the patient balance automation system, you can be confident that claims will go out in real time, or in the case of a cash patient, the patient's account will actually be charged for what you provided that day. And in addition, you and your staff can be confident that your patient statements will show an accurate patient balance. We all want peace of mind when it comes to documentation. With the new XDoc platform and the speed at which you can document, you can be confident and have peace of mind that every note is done every day, preventing that piling up of notes and that snowball effect that we've all had in the past. You can be confident that you're compliant, that you're sending intake forms in a HIPAA compliant portal, that what you've coded and charged is actually supported by the documentation you created for that day. And with the real-time narrative generation, you can be confident that your note actually reflects what you did with the patient for that visit. I hope you enjoyed this overview of the new XDoc platform. We have a lot more updates coming. This has been released in beta, so it's available for your use right now. If you'd like to use the new XDoc platform, simply open a task to your team and request some training and implementation guidelines on how to get started with this. Again, we have lots more coming with this. We're really excited for you. Really excited. This has been a long time coming. We'll definitely be creating more tutorials and more detailed training on how to use the new platform coming soon.